Hello and welcome to the Raphael Studios. I'm Bridget, I'm a yoga teacher and a psychiatrist, and I'm here today to share with you a breathing practice known as Sparsha Pranayama. This has been brought to us by Dr Ananda Balayogi, who is a physician and a yoga guru working in Puducherry in southern India. Dr Ananda is currently working in the hospitals in Tamil Nadu, treating patients suffering from and recovering from COVID-19, and has found this, amongst other pranayamas and practices, helpful in treatment and recovery. I would suggest you do this practice twice a day, up to 10 or 15 minutes each time. Thank you.
The best position to do this in is in Vajrasana, which I'm sitting in now. So you're sitting back onto your heels. If you're unable to do this, you can place a blanket or a block beneath your legs so that you raise yourself up slightly. You can sit on a meditation cushion, which is something like this, or you can sit cross-legged. The thing that you can even sit in a chair. So the thing is to keep the spine lovely and straight. Now think about the lungs as three separate sections. So we have the lower, the middle, and the upper. And in each of those three sections, there is a front, a side, and a back. So this exercise is about bringing the air, the oxygenated air, into 9 parts of both lungs. And we do that using the hands. So the hands, where the hands goes, our awareness flows, okay? So where we bring our hands, if you think about that, if you reach out and touch something, you automatically are drawn to it. So our hands are going to direct the air. Now, if you can't get them into exactly the right position, because you're stiff or your shoulders are stiff, don't worry. You visualize breathing into that space. So we're going to start with the abdominal breath. The hands are just at the lower ribs and the fingertips just slightly together when you completely exhale. Now closing the eyes, I want you to breathe in for 3 and notice the front of the abdomen inflate and breathe out for 3. I want you to do this 3 times as you're breathing in and out of the front of the lower section of the lungs. Directing your breath just to this area. When you've 3 done, slide your hands around the side. So we're still just at the lower ribs, the baby fingers probably touching the abdomen. Again, breathing in for 3 and out for 3. And doing that 3 times. Bringing your awareness to the side of the lower lobes of your lungs. Now to bring your awareness to the back, you bring the palm of your hands in contact almost with the kidney area of your back. So it's along, just see where my hands are here, the lower parts of your ribs. And you're breathing in 3 and out for 3, again, 3 breaths. Notice how the hands move. Now let's move up onto the middle section of our lungs. Place the hands over the chest. The middle fingers rest at the sternum of the breastbone. We're going to breathe in for 3 and out for 3, again 3 times. Observing the expansion of the anterior part of the middle of our chest. Now when you've those 3 done, you're going to slide the hands round to the side of the chest. And again, depends on how flexible your shoulders are. If you can't get up as high as that, remember just to direct the breath into that area. This is the side of the middle section of our lungs. I don't want you to strain your breath. That's why I'm just saying count for 3 and out for 3. I want the breath to be easy but full. And then the final is when you bring the hands around the back, just higher than they were for the abdominal breath. Perfect would be if you can get them on top of your scapula, so on top of those big bones at the back. But if you can't, I want you just to place them wherever you can and imagine breathing into the back of your scapula. Almost feel them just winging as you breathe in. Let's move up onto the upper part of our lungs now. So you can place the fingertips on your chest like this, or you can cross the hands if that feels more comfortable. Just make sure you don't constrict the breath. And you're listening internally for the movement of the upper parts on your fingertips. This is the front of your upper section of your lungs. It's a very subtle movement. It's a very tiny part of the lungs, but needs oxygen, same as all the rest. Now, the middle part of the top of our lungs corresponds to very high up in our armpits. But if we press in there, we're going to be pressing on the brachial plexus. So what we do is we place the baby finger side on the hinge of the hip and then just hook the thumb in around the back, okay? So the hands are actually resting on the lower abdomen. And we breathe into the armpit area. So neurophysiologically, these correspond. I know it looks a bit strange, but we're actually encouraging the opening of the middle section of the upper parts of our lungs. And finally, we're going to come to the very top part at the back. Stretch the arms overhead, bend the elbows, palms of the hands on the back shoulders. And we're going to breathe 3 in and 3 out for 3 times. Now, when you have finished, I want you just to lie down on your mat and relax into Shavasana.